The Health Secretary, Matt Hancock, says the NHS should be ready to roll out a coronavirus vaccine by the start of December if it's approved. But he urged caution, warning that it would be an enormous logistical task, and it wasn't clear how many people would have to be vaccinated in order for life to return to some sort of normality. If regulators decide that it is safe and effective, the vaccine will be offered to the most vulnerable patients first in what would be a 7-day-a-week operation. It comes as the UK recorded its highest daily death toll today. Since the middle of May, 532 more people have died. Here's our medical editor, Fergus Walsh.
This is Liquid Hope, the first COVID vaccine proven to be effective in production in Germany. If regulators approve it for use, a few million doses of the Pfizer-BioNTech vaccine should be available in the UK before the end of the year. The Health Secretary said the military and NHS staff would be on standby to roll out a vaccine from the start of December.
The uncertainties are real and the scale of the job is vast. But I know that the NHS, brilliantly assisted by the armed services, will be up to the task.
So who is going to be first in line to receive it? Put simply, the older you are, the sooner you're going to be eligible for a COVID vaccine. Currently in pole position are elderly care home residents and staff. Then people aged 80 and over, plus frontline NHS workers. The vaccine will then be allocated to younger age groups in bands of 5 years. But that is dependent on it being effective in older adults, and we're still waiting for that data. Adults under 65 with underlying health conditions will also be given some priority. There should be enough doses of the Pfizer vaccine to immunise 20 million people, so younger adults may have to wait for other vaccines to come through. The Pfizer jab is not intended for children. Vaccinators will go into care homes to immunise vulnerable older residents. GP surgeries will play a crucial role. Some may be open 7 days a week. And large venues like sports halls are also likely to be used for mass immunisation. The Pfizer vaccine trials were mainly conducted in the United States and Germany. Initial findings suggest it's 90% effective at preventing COVID-19. Caution is needed, but the early results are surprisingly good.
Even the optimists amongst us were hoping for 50 or 60%. So this puts this vaccine straight up at the top of the league in terms of vaccines that we have and how effective they can be.
Traditional vaccines use a weakened or inactivated whole virus, but the Pfizer COVID jab uses only a tiny amount of genetic code found in the spike protein on its surface. This synthetic RNA is what prompts the immune system to recognise and remember coronavirus. This bodes well for other COVID vaccines, which also use the spike protein to create immunity. Results from the Oxford-AstraZeneca vaccine trials are expected in a matter of weeks.
Yeah, no problem.
How do you feel?
I feel fine.
If they too are positive, it would be another decisive step out of the shadow cast by this pandemic.
And Fergus is with me now. So this vaccine could be rolled out in the UK in just 3 weeks' time if it's safe. Is 3 weeks long enough to know?
So safety, Sophie, is absolutely crucial. Pfizer says it should have 2 months follow-up safety data on all 43,500 volunteers before it applies for emergency authorisation for use in the UK, Europe and the United States. Now, we've been told there have been no major adverse effects so far, but we should expect that this vaccine will have side effects. Every medicine from aspirin upwards does. And no vaccine is 100% safe. But you have to balance that against the risks from COVID. We had more than 500 COVID-related deaths today. And then there's the issue of long COVID, which has left tens, maybe hundreds of thousands of people here in the UK with lingering health problems.
And then there's also the issue of how long immunity will last once you've been given the injection.
We simply don't know because the trials only began in July, but the manufacturers and other scientists hope it should provide protection for at least a year or two. Then we may need a booster dose. Now, if the virus starts to mutate so it can evade the immune system, we might need a slightly tweaked vaccine, a booster there, like we do with the flu jab every winter. But all that's for the future. For now, Sophie, we remain in the grip of this pandemic, and we can't lower our guard.
Fergus Walsh, thank you. Well, the latest government figures show 532 deaths were reported in the latest 24-hour period. That's people who died within 28 days of a positive COVID-19 test. It's the highest figure since the 12th of May. It means, on average, in the past week, 360 deaths were announced every day. It takes the total number of deaths so far across the UK to 49,770. Meanwhile, plans to carry out more mass testing from the end of November have been announced, including for all university students in England. With more, here's our health editor, Hugh Pym.
Getting students home for the Christmas holiday without risking the virus spreading. It's a logistical challenge. Today it's emerged that a week of mass COVID testing at universities in England could start at the end of the month. So what do students think?
The way students have been treated at university has been abhorrent. Like kids are trapped inside one room.
That would be great because I really want to go home to see my family, so that would be awesome.
I can't see them getting it out to tens of thousands of students across the country in a couple of weeks.
Rapid testing kits like this, with results back in 1 hour, will be used in universities. And from this week, NHS staff in England will have regular testing using the same technology. Making it more widely available is one of the government's priorities for trying to curb the virus. But the established test and trace system in England has been criticised for problems getting bookings, delays receiving results and difficulties reaching contacts of those testing positive.
Baroness Harding, do you still believe test and trace is working?
Today the head of test and trace faced questions at a Commons committee, with one MP setting out what were said to be shortcomings with the system.
Given this catalogue of failures, should you be reconsidering your position?
Well, thank you for that report card. If we step back and compare what we've delivered versus what we said we would at the end of July, we have met the vast majority of our commitments. So we committed to building testing capacity to 500,000 per day by the end of October. Testing capacity today is over 500,000 a day.
It's been hard for the testing system to keep up as cases and hospital admissions have risen steadily. The latest daily reported death toll was above 500 for the first time since May, though other figures out today for the last week in October give a broader picture. One way of assessing the COVID impact is looking at the total number of deaths from all causes. This line shows the 5-year average for UK weekly deaths. And here's what's happened so far this year. And you can see a sharp spike in April at the time of the first wave. The red area shows COVID deaths. There are other excess deaths as well. Some could be linked indirectly to COVID because people didn't seek hospital treatment. Then it falls back towards the average before picking up again, though it's still nowhere near where it was at the time of that first wave. And here's what's been happening in recent months. And you can see just since October, the death toll has gone back above that 5-year average. Reducing cases and saving lives is the aim of lockdown restrictions. Health officials hope that'll also allow test and trace to be more effective at controlling the virus. Hugh Pym, BBC News.